Latent energy is in there, and at any time you can tap into it, open it, release it, and allow it to surround you, permeate your whole body, and utilize that energy to give you continuous activity, strength, positivity. So engage with your core. Take your thumb, lightly push it into your belly button, close your mouth, your lips, and swallow. Connect. Breathing in space, lift and elevation. Exhaling, letting go. Not collapsing, merely surrendering into the lift, the space that you have made. Let's take the hands in front of us, link the fingers, invert the hands, stretch them forward. Breathe, observe, feel. Now in a moment we're going to take our hands above our head. But we're not just going to use the arms to achieve that. We're going to take our mind to the lower back. We're going to engage the flesh, the skin, and as we breathe in, we're going to tell it to lift up. We're going to activate the lower back muscles and ask them to lift up the torso. And when you feel that lift happen, everything above wants to follow suit. So actually your back, your sides, your stomach, the trunk of your body is helping you to lift your arms. Now if you need a bend in your elbows here, if you're new to the practice, always remember comfort. The fantastic thing about yoga is you tailor-make it to suit you. And the amazing thing about it is if you stay dedicated and continue practicing, you will see, feel, experience every change that takes place in you. Let's lower those arms, release the hands, reconnect, relink the fingers with the opposite index finger on top. So it should feel a little strange. If it doesn't feel strange, you've possibly just reconnected your hands the same way. In your life so far, you've probably utilised one side of your brain more than the other. Yoga brings us into a far greater spaciousness. It taps into both sides of our minds and makes them begin to work equally. Again, you're lifting through the trunk of the body, you're rising the flesh upwards, engaging your torso, the trunk of your body, to assist in your arms lifting above your head. Once your hands are over the crown of your head, try and just check with the fingers as well that your thumbs aren't sticking up. Can you pull them down a little bit? Your little pinky fingers, are they resting flat? Again, don't judge yourself if it's not happening immediately. No race, no rush. Just be watchful and observe. Let's bring those hands and arms down and release. So we're going to work on the spine, your spinal cord. It's your central axis, your head and your spinal cord are your central axis. You have 33 bones in your spine. Some of us have 34 in the coccygeal region at the very base of your spine. There's a differing of that one bone. So 33, 34 bones in the spine. Close your eyes and take your mind's eye right down to the base of your spine, the coccygeal region. Flat and fused bones, but if you ask them to lift, they can lift. Above them, the sacrum. Again, flat fused bones, but you can lift them all together. Make space. Every breath you take in creates space. The lumbar, dorsal region of the spine above the sacrum. And then we connect to the thoracic part of the spine. The individual vertebrae. And in between each of these vertebrae are little discs. So many of us have problems, difficulties, challenges with back pain. And it's often because we have not maintained its health. If we just breathe in and lift up, make space, allow those intervertebral discs to get some space between them so that when you breathe, the oxygen you take in can find its way there. To soothe, to heal, to help new growth. And lift the skin around the spine, on your back. Think about your back, the flesh there. When you breathe in, ask it to elevate. And your stomach, engage your stomach muscles. Pull your tummy in, back and down so that it supports your spine. If you leave your spine to do all the work, it will get tired, it will erode, it will start to become painful. Get your stomach working, assisting, helping, engaging, supporting your spine. And lift up to the cervical spine, those intervertebral discs and individual vertebrae that are leading towards the neck. The very top, the atlas and the axis. Pivotal bones where your skull sits on them. It allows you to drop your chin to your chest, to come back through the centre, to drop your head back and allow your chin to rise up, to come back to a neutral position, to turn and look over your left shoulder, to come back to a neutral position, to turn and look over your right shoulder and back to a neutral position, to tilt to your left, to come back through the middle, to tilt to the right and back to the middle. You could pause the video here now and again go through all of those movements slowly and become aware and start understanding exactly how much potential you have for the movement of the head upon those top two bones of your spinal cord, the atlas and the axis. So let's do a twist of the spine now. We know there's 33 bones. We know we need to pick up and make space, because then we can move into that space that we've made. We're going to take our left hand and place it outside of our right thigh. Take our right hand and place it behind us, almost using it as a prop to bring us to lift up through the spine. Be aware that you don't do this and lean back. You want to always now start to look at having your head centrally over your shoulders, and your head and shoulders over your hips. Engage in the stomach to support the spine, especially this lower area, and asking your flesh to help a little, to engage it, to pick up. It's a total body experience. No longer are you just going to be using one part. You're going to make everything work for you in true graceful synchronicity. So, let's take our left hand to our right thigh, right hand behind us, using it, that arm, as a prop. We breathe in, we lift up, we create space. The tummy pulls in, and as we exhale, as we breathe out, we start to turn the spinal cord to the right. We take our time so that we can truly experience the movement, and that we can ask the flesh on the sides of our body to help the spine rotate. We may move up through the middle spine, the upper spine. The last thing to turn is the head and the neck. Soften that right shoulder, avoid holding it up by the chin or the ear, and unclench your teeth. See if you've started to clench along the jawline. Can you let go? And breathe. Observe your breath, feel it.